A month ago, just about May 9th, I received this report from your predecessor, Dr. Petzel, and John Mendoza, the director of the El Paso VA. And it's entitled, Wait Time for Initial Visit to Mental Health Among Patients New to the VA. And it shows that right now, 0 patients are waiting longer than 14 days to see a mental health care provider. Actually, that was for March, and then for the month before that, it was 0. And it was like that all the way through the past 12 months, where the longest average wait time was 3 days. The audit that we got from the VHA this week shows that that same group, these are new patients seeking mental health care appointments, it's actually 60 days, which makes El Paso VHA the 4th worst in the country. When we look at established patient mental health care average wait times, it's the absolute worst among all VHAs in the country. I want to know what the consequences are going to be for publishing false, inaccurate data. You know, I'm sensitive to the comment that my colleague Ms. Titus made about saying that these are lies, but I don't know what explains it, and the consequences could not be more dire for the people depending on this. So I'd like to hear concisely what the consequences are going to be.
So we've had a little bit of a discussion about this, and I can't say what the consequences are because I don't know how it happened and by whom. And I think at the bottom of this is that we looked at data that we assumed to be correct. We didn't challenge ourselves to find out that it wasn't until we got down and did this audit. So I don't know that, you know, without looking into it, and frankly, this is why we have the IG and others doing these investigations. If somebody deliberately misled you or anybody else on this data, there will be consequences. I'm not a lawyer. I can't speak to what those would be. So.
Let me follow up with this.
Sure.
I also shared with you a survey that we did because
Yes.
there was such a discrepancy between what VHA has been reporting since I've been in office the last year and a half and what veterans are telling me. And we found in that statistically valid survey that 36%, more than 1/3 of the veterans that I represent who seek mental health care appointments, not only cannot get in within 14 days, they cannot get in at all. That, to me, is a crisis. When you have 22 veterans a day killing themselves in this country, when I learned from one of my constituents, Bonnie D'Amico, that her son, a veteran, came to one of my town hall meetings, heard veteran after veteran go up to the mic and say, I can't get in. On the drive home with his mom that night from the town hall meeting, he said, you know, these guys are a lot older than I am. They've been trying to get into the VA system longer than I have. What does that say about my chances? 4 days later, he killed himself. I think this is a crisis, and frankly, I do not see the urgency from you. I do not see the commitment to accountability from you or others to address this. If I knew what you now know and I were in your position, I would fly down to El Paso immediately and try to discover who those 36% of the veterans seeking mental health care appointments who've been denied and locked out of the system are. You're not doing that. You know, we spoke the day after I released the report. We asked for a plan of action. We spoke then Monday of this week. We asked for a plan of action. I asked you before you sat down. You said you were going to go back to the office and take a look at this. I've been very patient and very cooperative in working with the VA. That has not served me or the veterans that I represent very well. I understand you have a lot of demands on your time right now, given what we've learned from Phoenix. But we have a crisis in El Paso, and I would argue in many other places, but I've identified it for you. I've given you the information. I'm willing to help you. I'll use my own resources to track these folks down with you. But you have the list, the information, the veterans who've sought care and not been able to get it. When are we going to get that urgency from you, and when are we going to connect them with the care that they deserve and that they've earned?
So as I said when we spoke earlier, when I get back to the office, I will get the final answer. I don't know why you haven't gotten the plan yet. I would hope that by now all of the veterans would have been called. And as I said, my concern is the 36% number that you have in your survey, because I'm concerned about the ones that we know, but I know we can help them and get them. And I'm really concerned about the ones that we don't, and how we reach out to them and ensure that, you know, people who think that they're waiting for an appointment and somehow we've missed them or dropped off, I don't know. I'm really worried about them, and I have offered to come down. We will get a time and figure it out.
Okay. So. I'm going to use every opportunity I have when you or someone else from the VA or the VHA appears before us to press this issue, because we know about it. You say that you have a commitment to it. We have yet to see a plan of action. I think we need a SWAT team flown down to El Paso to go connect these people. Again, I would like to be part of the solution. I offer myself and my office our resources to that effort, but we need to get it done.
And actually, I thank you for that. I very much appreciate you wanting to be part of that solution.
Thank you.